Good morning, and thank you for having me here, Beth, and tonight also. No disclosures. What are the ideal goals of cardiac support in the cath lab? You basically have two patient populations. One is the high-risk PCI, and the other is the more sicker patients, the acute MI and cardiogenic shock patients. So the ideal cardiac support, I think, should be a safe and simple, quick to implant. It should give you a systemic hemodynamic support as well as to protect the myocardium. So this is the evolution of the cardiac cath lab. Back in the 60s, 50s, the ECMO came up, and it's still available. It's still very popular in the OR suites. Then it came the balloon pump, the cardiac, the bypass in the 80s. Hemo pump was actually one of the first percutaneous device available in the cath lab. The tandem heart, and then the two new devices, the Impella and now the CardioHelp. I'm going to go, the next slides are going to go a little more in depth in a couple of these devices that we use in the cath lab. So these are the differences. This is the balloon pump on the left. It's not a pump. The heart is technically the pump. It does increase the coronary blood flow when it inflates in diastole. It's inotrope dependent, meaning that you will need some type of meds, the vitamin, epi, since you need something to help the heart pump. It's time independent, and you can go only up to 1.5 liters per minute. The tandem heart in the middle, it's a pump for the heart. We haven't used this in the cath lab here. We done just a few cases in the last year. It's mostly used as a bridge to transplant, and you can get up to 5 liters and 8 liters if it's surgically implanted. You have the Impella, which pumps with the heart. When it's working, it makes the heart rest, and we have the 2.5 and 5.0 liters if implanted surgically. This is the new device that we have available. It's called the CardioHelp. You can get up to 6 liters of support. It gives you a full respiratory support, and it has the ability to induce mild hypothermia, and also it's very portable, as you see. So this is the algorithm that we use here in the cath lab in order to manage these high risk PCIs, and helps us decide which device to use. And it's very simple, actually. If you see on the left, if you have an EF greater than 35, whether it's a simple or complex. If it's a simple, you use you don't use support. If it's a complex, you use a balloon pump. Then you have the ejection fraction from 20 to 35. Simple, PCI, you use a balloon pump. If it's complex, you can use an Impella, tandem heart, or CardioHelp. And for those cases with the EF less than 20%, whether it's a simple or complex, you can either use a Impella, tandem heart, or CardioHelp, depending on how much support you want to get. This is just the data from Sinai here. Out of 400 PCIs that we did last year, we used about 25 balloon pumps and 4 Impellas. So this is some principles of the balloon pump. It inflates in diastole, therefore increases the coronary perfusion and increases the oxygen supply. When it deflates, it creates a vacuum-like effect, and by doing that, it decreases the cardiac work, and also will increase the cardiac output. This is a tandem heart. The pump in the left, the centrifugal pump, and the 2 cannulas. If you can see here is the curved cannula. That's the cannula that goes into the left atrium To do that, you'll have to puncture the septum and go transeptally to the left atrium, and then you have the arterial cannula. This is the Impella technology, different catheters. In the cath lab, we use the 2.5 and the CP. And this is just a little animation of the Impella going into the ventricle. It goes over a wire, a 1/8, sits in the left ventricle, and by doing that, blood goes out from the inlet area up to the aorta. By doing that, it will rest the heart, and also will increase the myocardial perfusion to the vital organs, as well as the brain. I also have a case study that we did, not too long ago, and I'm going to be showing you that. It's an 87-year-old female, presents to the ER here at Sinai with chest pain, non-STEMI with a troponin number 7.4, DF 19%, medical history, hypertension, high cholesterol, diabetes, controlled because it's only one med, insulin. Medication includes Lopressor, Plavix, aspirin, and Ronexa, Crestor. The result of the cath, after we take pictures, we find 3 vessel CAD. We find a left main disease, instant restenosis of the distal left main, LED prax, LED circ, and with severe systolic dysfunction. So we go ahead and we implanted the Impella device, and we put one stent on the circ, and we open up the stents. I'm going to show you the pictures in the next couple of cases. So this is the first picture of the diagnostic. It's as you can see clearly, it's not a good stick. It's right on the profunda, and the reason why I chose this slide is actually to show you what a bad stick looks like. Okay, it's the stick should be right above the bifurcation and just below the gastric epigastric artery. Okay, so they went ahead and they restick. The advantage of using this micro access is just a 3 French dilator, and you can hold pressure and restick it again. We take the picture, and what we find is a 99% left main bifurcation. It looks really bad. Take another picture. Has a circ lesion here. Take an elbogram. You can see the heart is not pumping. You can see the lateral wall is not moving, inferior wall not moving. It's next picture. It's the right. You have some lesions here on the right, on the distal RCA. It's dominant because you can see the PDA coming from the right. So they go ahead and they take they take access from the other side using a micro access. This is a better stick, and the reason why we do that is so we can pre-close, put 2 per-closes on and leave the sutures on the side. And that will assure us that after the case we can use that closure device. We have the Impella here on the ventricle, sitting on the ventricle. We have a temporary pacing wire here in the RV, and we're using 2 high pressure balloons. We're using a kissing balloon technique, and this is how it looks like at the end. Patient did good. They went home the next day, I believe. So the take-home message, the left ventricular support devices are used when undergoing high-risk PCI in a setting of acute MI or cardiogenic shock. There are multiple devices in the market that meet these various needs. Patients, there's a balloon pump, time to heart, cardio help, and Impella are the most frequently used here in the cath lab. I think they all play a role for these patients. Education, I think, is the key for successful use of these devices, and hopefully the prognosis of these patients can be improved with the use of these devices. Thank you. Questions? I have questions. Sure. So these are my questions. True or false? The Impella 2.5 or CP directly unloads in the left ventricle? Good job. When the Impella 2.5 or CP catheter is properly placed, it reduces A, aortic pressure, V, ventricular and diastolic volume, ventricular and diastolic pressure, or D, B, or C, and C. Good job.